In this week's show, Nigel investigates noises in a chimney. Lisa meets Tim Munro to talk about dog safety and try out an unusual therapy method. Dr. Kevin helps out two dogs with paw problems. First, Julija and Flick show us how to jump through hoops.
Hi, I'm Julija and this is Flick, my beautiful border collie. I work with a lot of people and their dogs and often get told, I don't need my dog to jump through hoops or anything special. But do you know what? I think that if they did teach these skills to their dogs, it'll make the skills that they actually want their dog to do so much better. So today we're going to have fun teaching you how to get your dog to jump through a hoop. It's a sure crowd pleaser. It'll bring a smile to your face and your dog's while keeping your dog agile at the same time. Come on Flick, let's show them how to do it. Hoop. Yeah, good job. Nice one. Your dog will be watching your body language a lot for this skill, so make sure that you use it to your advantage. Have your shoulders facing the way that you'd like your dog to travel. When I've got the hoop in front of me, Flick's looking at me as though, Mum, what is it that you want me to do? Even if I hold it to the side while she's still in front of me, she's looking at me going, I'm really not sure what to do. But if I have Flick positioned behind me with a hoop beside me, now my shoulders are pointing in the direction I'd like her to travel, she can clearly see, ready Flick, hoop, hoop, that she needs to go through that hoop. So let's get training. You'll need a hoop, maybe some big chunks of food or your dog's favourite toy. When commanded, I want my dog to jump cleanly through the hoop without getting her legs stuck and tangled. Once the dog knows the skill, you should be able to hold the hoop wherever in relation to your body, or even have another person hold the hoop for you while your dog jumps swiftly through it. Be mindful of the size of your dog. This will determine how high your dog can jump. Once your dog knows the skill, don't hold it any higher than their shoulder blades. Each dog should be jumping according to their own height. I would limit jumping on young dogs and wouldn't allow them to jump full height until at least 12 months of age. Up until then, they should be jumping no higher than their elbow.
Animal Rescue, Nigel speaking. Animal Rescue, Nigel speaking. Animal Rescue, Nigel speaking.
Hi.
G'day, Nigel from Animal Rescue.
I'm Gigi.
Pleased to meet you, Gigi. This is Keegan.
Hi.
And you got an animal down your chimney.
Yeah, unfortunately.
What have you been hearing?
We've just been hearing like scuffling sounds.
Right, for how long now?
A
Couple of days now, okay. Well, we get possums, we get birds, and we even get ducks down chimneys.
Oh, okay.
So take me through, let's go and have a look, see what you've got. Oh, I can see them. What do you think we've got?
A bird?
Yep, you're right. We've got a magpie. I'd hate to count how many times I've used a coat hanger to rescue an animal. You can poke them into areas and spots and get animals to move to where I want them to go to. Ah, gotcha. I've got his legs. Okay. Here we go. Okay, here he comes. Here we've got a baby currawong. Very unusual. In 30 years, I've never rescued one of these guys out of a chimney before. You can tell he's a currawong with the white that he's got on his feathers and that noise. And you are pretty hungry, aren't you? Yes. I think we'll get you some food and give you a drink. Well, you're one very lucky little currawong. It's a juvenile. It's the first time in 30 years that I've actually rescued a currawong from a chimney. I've noticed over the last sort of 5 to 10 years, we're getting more and more of these guys down in the suburbs in Melbourne. Normally, you find them up in the high country, up in the snow. But I think with the bushfires that have happened, that they've moved down. So he's got a very gunky eye here, as you can see there. And that's due to all the soot. He's been in the chimney for 3 days now, flapping around. He's been disturbing all the soot. It's through his whole body. It's going to be inside of his mouth. So I think the best thing is we've given him a little bit of water and a little bit of food at this stage, but we take him down to a wildlife shelter and we get them to rehabilitate him and bring him back here in a couple of days and let him go back to his family again.
So you've noticed Dun Dun having sore feet for about a week? Okay, so he's got some pockets of infection in between his toes, and he's got quite a few of them. There's a pocket here, there's quite a marked swelling in this region here, and on this foot there are a couple more. There's one here and then one here. And what I think is causing these are little grass seeds. Okay, I can actually see a few of them in his feet, and little grass seeds he's picking up walking through the grass. And grass seeds are shaped like arrows. They've penetrated his skin and they've actually gone completely into his skin and set up an infection. Okay, so I can certainly make him feel better. We can give him some antibiotics and some anti-inflammatories and that'll come down. But the only way to really get on top of the problem is to remove those grass seeds. So he has what we call grass seed abscesses. It's quite a common problem, particularly this time of year. And what we're going to need to do is we're going to need to give him a light sedation and actually make some small incisions or holes in where those swellings are, flush it, remove the infection, but also remove the offending grass seed. What can sometimes happen is that those grass seeds, once they get and bury into the skin, they can keep going. And sometimes they can travel quite vast distances in their bodies and cause more serious problems later down the track. Well, I will look after him. I'm going to get him comfortable in our hospital. I'll give you a call a little bit later this afternoon after he's had his procedure, and then we can organise either a discharge time for later this afternoon, or potentially he'll stay in our hospital overnight and we can send him home tomorrow. Oh, you were very sensitive, aren't you, little man? Okay, well, we might need some of these rewards. That's what he's after. I'll get you to give these to him, mate. Just try and give them to him a bit slowly. Okay. Hey, Fudgy. Fudge. Okay. Okay, so interdigital areas are nice and clean, so there's nothing stuck in and around that region. The last patient I just had some grass seeds stuck in between his toes, which is the reason why he was licking at his feet. He's certainly done something because the main pad, I'll just show you on one of the feet that isn't sore. On this aspect, on this pad, on his back left leg, he's missing about 1/3 of the pad. So he's had some sort of injury where that has basically, he's got a full thickness wound on that area. So he's either scraped on something and it's torn off basically, and once that pad's removed, it's incredibly sensitive tissue underneath. So that's why he's not weight bearing properly on that leg, and dogs will lick an area to make it feel better. And that's what he's doing on this back left foot, so it'll come loose. So.
Okay.
So,
doesn't seem too bothered, as you can see.
No, that's right. We're applying with some liver treats. He's obviously just distressed when we touch it. So last time we did need to give him a light sedation to bandage it properly. So I think we're going to need to do the same. You'll need to leave him with me. He can go home this afternoon though.
Animal Rescue, Nigel speaking. Okay, matey, we're at the South Oakley Wildlife Shelter where you're going to be looked after. Yes, you are. We'll go and see Michelle. Hello, Michelle. You home?
Yeah.
Hi, g'day. How you doing, love? Good. I've got another patient for you. Little Currawong. He's been down a chimney for 3 days now, but he's got a gunky eye on him.
Oh, we can clean that up.
Yeah, I'm sure you can. I believe you've got another one in care at the moment.
I've got a baby in care at the moment.
Oh, fantastic. So he's got a friend.
Yep.
Lovely.
I'm really happy. All right, come in.
It's dried up a lot from what it was when it first came out. It's obviously a lot of soot.
Yeah.
He's got into his eye. Yeah, it's black. His whole body's going to be covered in it.
I'll hose him down after all.
Yeah, look, there's soot coming off him.
I think it'll have to be bathed sort of frequently. I'll have to bath it like every couple of hours just
Yeah, until you get it all out.
until I get it all out.
Okay.
I'll give them a bit of food and a bit of water.
Yep. Terrific. Can't see it. It's pretty hard to open the beaks.
It's forcing it closed.
Yes.
That better?
There you go. You got some food happening. Yes. That's your first bit of food really in 3 days.
Look, curry. Look. There you go, Russell. You've got another one. Perfect. If he feeds himself, he could go back within 24, 48 hours.
Yep. Terrific.
His flight's perfect. Just depends on his eye, but I might take him to the wildlife vet tomorrow night.
Yep.
Get the eye checked.
Yep.
If that's all clear.
Yeah, if the eye had been clear, I would have, just fed
Just
him
let
up
him
and
go,
let him
yeah.
go.
Dogs are incredibly expressive animals, and I think that's one of the reasons why we love them so much. But sometimes a misunderstanding between the two of us can lead to aggression and sometimes even a bite. Today I'm meeting up with animal behavioural specialist Tim Munro to help us be a little bit safer around our dogs. Tim, you're here today to talk to us about dog safety. What are some of the myths that you can dispel for us?
Yes, thanks. Interestingly, most dog bites tend to occur in the home or with a family dog. There's been some recent research that has shown that about 92% of those bites are actually from known dogs.
What are some of the warning signs that we can be aware of if a dog is feeling uncomfortable?
Absolutely. So it's being able to understand their body language and that they're not happy with those interactions, and some of those can be very subtle. Some of them are obviously more obvious if they're growling and barking and lunging out towards the kids. The more you can understand those earlier signals, the less it's going to escalate and become a problem.
Right, I guess they're just like people really, aren't they? They get grumpy, they get tired.
And if you don't pay attention to them, then you lash out.
That's right. And with families, I guess kids can be a little bit rough and tumble. What age would you recommend families introduce dogs?
So if you're going to bring a dog into a new family, kids under the age of 5, they found that they struggled more being able to understand those body language signals and were more difficult to teach them to respond around that. But obviously it depends on how responsible you are and how well you manage the situation and your children as well.
Now Tim, we're using a stuffed dog because obviously you're going to teach us what not to do.
Yes.
What are some of the things that we should avoid?
So pulling on ears, sticking fingers into mouths and eyes and nostrils. And that's a space of safety. You know, if someone was to come and start to do that to you, it's not going to feel that great. So
No.
It's something that I think, because they've got floppy ears or pointy up ears, it's a common thing for kids to grab onto, and often that's something that they pull. But even fur from anywhere else, so that's probably one of the common ones that starts to create problems.
I also understand that dogs don't enjoy being at the bottom of a stacks on. So
Yes, kids jumping on top, particularly if they're asleep as well. So that's one of the rules we tend to tell them is, leave a sleeping dog alone. So actually having a crate or a kennel or even just their dog bed, if there's a rule that you can teach them that says, if they're there, leave them alone. That's their safe space they can go to. And it means that if the dog is stressed, that they have a place that they can retreat away to as well, which is a really great idea.
like humans, dogs feed off the environment around them. If your kids are excitable and doing burnouts in the hallway, there's the potential your dogs will do the same. Try separating kids and dogs at high energy times of the day. With unfamiliar dogs in public settings, there are definite behaviours to be aware of. Tim, often when you're out walking in the park, you'll come across a dog tied up to a tree. What are some of the signs that you should not approach?
Yeah, absolutely. Well, that's one of them, if they're making sound and barking and growling at you. The big one really is if they're there by themselves. If their owner or their person's not around, then kids need to be taught absolutely not to approach.
And if there is an owner around that says, yes, my dog is absolutely fine to come and pat,
What are some of the ways that people should approach the dog?
Absolutely. So if we come down close here, this is Stolly, letting them have a sniff of your hand first. That's good. Giving them that scratch on the front of the chest, around the sides, their shoulders.
So you wouldn't put your hand on top?
A lot of people often will pat the top of the head, and that can be not the best place to go to. You actually obstruct their vision, so they can't see what's around as well. But they could be a bit sensitive around their face and their head as well. So it's better to go for the chest or the side of their body.
I'd like to welcome my rookie dogs and their owners. We've got Luke with Noodle and Rachel with Barnaby, and we're going to work on the jumping through the hoops trick, aren't we, Flick? You ready? So to start with, having the hoop in one hand, positioned fairly close to the ground so our dogs are more stepping through it than jumping, we're going to use a piece of food and throw it through so our dogs step through and chase to that piece of food. So give that a shot with your dogs and see how they like to go. If your dog avoids the hoop, which some dogs do, they go, oh, it's really scary, hopping through that hoop, they want to run around it, make sure that you get your dog to what I call a point of commitment. So I use my hand and get my dog's nose all the way to here. So if I throw that food over, my dog's kind of forgotten all about that hoop and just does a nice step through. Flick, good girl. So we're looking at that point of commitment to here, and Noodle's joining in, and we throw that food forward, and my dog, whoa, all of a sudden just stepped through the hoop. As your dogs boost their confidence in going through the hoop, and these guys are looking really great doing it, we can start to lift that hoop a little bit. And we only lift it a little bit at a time. We don't want to raise it too quickly, otherwise our dogs will start ducking underneath it. Now, the other thing that people often tend to do is hold the food in their hand and get to this point here. And that's kind of as far as I can reach, but Flick's body is still halfway on the other side of that hoop. That's why I like to throw that food so I can get her to jump swiftly through it and make sure that she gets all the way through in one motion. I usually start with my dog in a controlled position like a sit for this exercise, and on cue get her to jump through the hoop. Ready, Flick, hoop? Yes, good girl. Generally the presence of the hoop cues my dog what behaviour to do, but you might also like to use a word like jump, through or hoop to get your dog to do it. And by saying that word, it releases your dog out of the sit to then perform the skill. Along with all the other tricks that you have taught your dog, jumping through the hoop is like the icing on the cake. We can't wait to see the repertoire of tricks that you and your dog have. Bye for now.
Tim, earlier in the show we were talking about dog safety, and now for some people at home they might have dogs that are quite anxious or reactive, and you've got a rather interesting method that you're going to show us today to help treat that.
Absolutely.
What have you got?
So it's wrapping dogs. It's using bandages, or there's also other things called thunder shirts.
Right.
It comes from a method called T-touch. What we think happens is that it helps change their awareness of how they fit in space, but also their internal sense as well. So it helps change their nervous system response from being very reactive and uncertain and worried about everything that's outside of them to being able to calm down, feel more relaxed internally, and that helps their whole system just settle. It's something that they've used also for kids with autism spectrum, swaddling babies, helping them relax, but also cattle in cattle crushers, things like that as well. So
Right, well I look forward to seeing how it works.
Absolutely. Well, what I'd like to do is actually wrap you first.
Really?
And see what it feels like. But what I'll do is I'll get you to walk through this obstacle course we have here first and just see what it feels like, and then put the wrap on you and see what difference you notice.
So we're going to see if I'm coordinated or not.
Absolutely.
Oh gosh. Here goes nothing. I'm not the most spatially aware person at the best of times, so I'll be interested to see the difference. T-touch was developed in the 1980s by equine specialist Linda Tellington-Jones. Now it's practiced globally and on many species of animals, and the odd human too. How did I go?
Good. Not too difficult, is it?
No, it's not
but
too
it's
bad.
the subtle things that we want to pay attention to.
I'm going to look like something out of ancient Egypt, aren't I?
Absolutely.
The nervous system is quite responsive in connective tissue, so placing bandages across joints can make a huge difference.
I've seen dogs that are barking crazy at another dog and we put a wrap on, they go quiet and they're just watching and able to see what goes on. So yeah, physical issues as well can be a really great one. So dogs that struggle going up and down stairs or have injuries or that sort of thing can be really useful.
Noticed I haven't barked once. Yeah, I'm shakier on this leg now. Yeah.
So subtle, but just a little bit more stability.
Yeah. Yeah, I can notice that. Time to put our four-legged friend Winnie to the test. Pay attention, Winnie. Let's see how she goes, all wrapped up. Oh, you get the nice bright blue ones.
That's right. So for some dogs, just around the body is really helpful. Other dogs around the head
oh, that's so cute.
Can make a big difference for them as well.
Oh, she looks so lovely and sleepy now. You're not going to make it through the course. Winnie's ears are tucked back against her head, indicating her inward focus. She's also no longer dancing around Tim's feet, showing she's aware of the space she's moving in. A subtle but positive difference. Not only is she more spatially aware, she's the most fashionable dog on the block.
That's right.
For a snug fit and a little warmth, there's also the Thunder shirt, which is highly effective for storm phobias. Well, my dogs were always scared of thunder, even rolling waves, and we had no idea about any of this, so I'm glad that we could share it with the people at home. And
absolutely, so some simple little solutions that might make a big difference.
Great. Thanks, Tim.
Pleasure.
And thanks, Winnie.
So Fudge has just been given a light sedation directly into his vein, which is going to make him a little bit sleepy, so we can examine the leg more fully and have a better understanding of exactly what we're dealing with. Hey, Fudgy boy. Good boy. Good boy, Fudgy. So we're just going to clean this wound up, and you can see there's quite a nasty full thickness loss of the main pad there on the side, but we'll give it a bit of a clean up now. Because it's quite a specialised structure, the pad of a dog, it can take a number of weeks for this to heal completely, but with the appropriate bandaging, care at home, and a course of antibiotics to prevent any infection getting in, Fudge will soon be back on his feet. Antibacterial ointment, we'll put directly on the wound. Some conforming bandage just to make sure it stays nice and snug. Here, sort of elastoplast dressing to make sure it stays in place. That bandage will stay in place for probably about 3 days. We'll get the owners to pop back in a few days' time. If the bandage stays on for that long, hopefully Fudge leaves it alone. And he'll need a couple of bandage changes over the next couple of weeks to make sure the wound's healing as well as it should be. With the antibiotics and anti-inflammatories on board, he's certainly going to be feeling a whole lot better. Here he is. Granddad's going to have a light sedation now so we can fully examine his feet and remove the grass seeds that are penetrating his skin and setting up these grass seed abscesses. He does not like his feet being touched, which is fair enough, given how uncomfortable they would be for him. So we're going to be cutting into the abscesses now, and hopefully we'll find a grass seed. There can be some situations where we'll open up an abscess and there'll be a lot of infection, but the grass seed actually has already been removed by the body. So we may not find a grass seed in every single abscess that he has present here. There's one. Very small, but enough to cause a lot of problems. You can kind of see the tunnel that's produced by the grass seed. My forceps can go in quite a long way in this area. The way to really avoid these is just to be thoroughly examining your dog's feet after they've visited the park or they've come from the farm, or if you've got long grass in your backyard, and keep your dog's hair trim in between their toes so that they're less likely to catch these sorts of grass seeds. But thoroughly examining your dog and pulling them out before they penetrate the skin is the way to avoid these nasty abscesses. Come on, there we go. There we go, my pleasure. So I'll just put these in a bag for you. That is the spray, that is the grass seeds.